Greetings and welcome to Ask the Doc. Today I'm joined once again by Dr. Waqas Ahmad, and we are going to speak to Dr. Sana Syed, and she is from NeuroX, and she is a specialist in dementia, but also multiple sclerosis. Welcome, Dr. Syed.
Thank you. Thank you very much. Very glad to be here.
It's an absolute pleasure to be able to see you like this, because you are a long way away, I believe.
Yes, absolutely. I am in Boston, Massachusetts. I have a bit of snow happening as we speak, so I'm sure very different from Florida.
Big difference from Florida. So before we go any further, tell us a little bit about yourself and your expertise in your field.
Sure. Thanks, Adrian. So I'm based out of Boston. I'm a neurologist by training. I have specialty training, like you said, in dementia and in multiple sclerosis. I actually graduated from med school with the Waqas back in the day from King Edward in Pakistan. And then I moved here and I did all of my training in Boston, actually. Residency at Boston Medical Center, and then my specialty training at Beth Israel Deaconess Medical Center. And I also did a master's in public health while I was doing my fellowship at the Harvard School of Public Health. And moving on, right now I work for a pharmaceutical company, Sanofi, but I have continued to see patients on the side. And what with last year, the pandemic and whatnot, NeuroX provided that opportunity to see patients remotely, which is why I joined NeuroX very, very recently, actually.
So thank you, Dr. Syed. So from the NeuroX perspective, and also keeping in mind your specialty, which is like subspecialty, multiple sclerosis, a lot of time it requires patient interaction. And from a neurology perspective, how do you see the NeuroX is covering that gap that you could still manage those patients remotely?
Yeah, thanks, Dr. Waqas. So I think for multiple sclerosis, actually having a remote provider is an asset, because in reality, it's very difficult to reach patients who have multiple sclerosis and who do not live in an area where such specialists are available sometimes. So this remote opportunity is actually it's a big relief for those patients who are able to be seen at home. And there are ways. I understand telemedicine is a novelty, and of course, as neurologists, our exam is so detailed. But there have been, as we adapt to the pandemic, we've found a way to actually examine and take care of these patients remotely in a very efficient way. And of course, the human interaction may still be required, but at least some of the care can still be done remotely. And I think the most important thing for these patients is that they have access to a specialist, especially for MS, where a lot of the medications and treatments are evolving so fast. Having that opinion, that perspective is so important. And NeuroX is kind of that platform that has helped achieve that.
As a layperson, is there some sort of tips that you can give, perhaps for people who are concerned about loved ones, people they know? Are there signs that somebody should be looking for, that are triggers that you think, now's the time, you need to get to see someone as soon as possible?
So MS, when it happens, can be a surprise, but usually when it manifests itself, it's rather clear, as it leads to a loss of vision or loss of functionality of your arm or your leg. So when you have these sort of unusual symptoms that actually may trigger anxiety anyways in of themselves, and you're of a certain age, I do think they will end up being at least worked up for a diagnosis of MS if they have access to the right healthcare and the right providers. Very rarely it's been manifest with unusual symptoms over several years that never actually fit anything in particular, like a particular diagnosis. They had some atypical numbness, they had some atypical loss of balance, but this is usually very rare. So I wouldn't advise people to go looking for a diagnosis of MS. But if they have symptoms that include like loss of vision or loss of functionality, they're young, these symptoms generally resolve and recovery is good. That may be MS is a differential for those types of issues. What I would say is that for folks who have a family member with an autoimmune disease or with MS itself, it's usually good to take vitamin D supplements. That is usually something to offset the risk of getting MS. I think that's more important.
Interesting. That's fascinating.
So now I know like you have also done a Masters of Public Health from Harvard Medical School, and now you are affiliated with the pharmaceutical company and running the trials on MS. And on the NeuroX side, the NeuroX offers second opinion services across the globe. And there's so many patients who are, especially in the developing countries, they want to get a second opinion services, and then most of the time they hear they're waiting for the new medication. What are some of the good news or updates you are seeing for those patients? How is the advancement has been in the MS field, or are there any new promising medications coming along in the near future?
So MS is a rapidly evolving field, right? And I've been running clinical trials for the last 3-4 years in the field of MS. I worked on the approval for cladribine at my previous job with a different pharmaceutical company. That was a good news for MS patients everywhere. I think there's two parts to your question. One is about developing countries and one is about overall clinical trials. Right now, I'm running an MS program for a new mechanism of action that is within MS, which is a BTK inhibitor, glutathione tyrosine kinase inhibitors. This is a relatively new field, and there's a lot of pharmaceutical companies, including mine and the program I'm running, that are working with this particular mechanism of action to see whether it can make a difference for MS patients. These are, of course, all clinical trials right now. So it's not to suggest that they work, but it is exciting to see that we're pushing the boundaries for MS. We're trying to target people with all forms of MS, with relapsing and progressive forms. Progressive MS has been an area of unmet need. So I think that in itself overall is very exciting, that companies are looking at MS with this vision of changing the care for the entire spectrum of patients. For developing countries specifically, I'll tell you that for them, the idea of getting access to a provider in another country with specialty training is extremely important and attractive. I think even within the US, it's such a big asset. And when you start talking about other countries, it definitely has an added benefit. I mean, when I was in fellowship at Beth Israel, and when I was doing my fellowship specifically in dementia, actually, even in that, I would get these third opinions from patients who were misdiagnosed, because dementia is just not Alzheimer's, right? There's a lot of other types of rare dementia, and you would not believe the number of patients I saw that were a third opinion, and they had a rare form of frontal lobe dementia or an aphasia that was completely missed. And for MS, I think it's a benefit for other countries as well, because access to MRI even at times is very difficult. So, and physicians may not even recommend it in those countries because it's such a guarded resource and so difficult to get at. And if you get that opinion from someone else and you know that you need to get it, or you're able to show your MRI to someone who has training in this specialty, because access to a certain subspecialty trained individual is also a barrier in some of the developing countries. So all of these together, I think, are are what NeuroX brings, not just in the US, but globally even, as you said.
And tell us, is there anything else that you would like to share with us?
I would share that I think NeuroX is on the on the cutting edge of where healthcare is going, and it's interesting how people are trying to solve healthcare from a country to country basis, and NeuroX has decided to take it on globally. So I think that is something very attractive and unique. And I think that for physicians and providers, it's very exciting to be a part of NeuroX because they get to help people from a very broad range of backgrounds and countries and issues. So, and I would also say that it's not just bringing providers and patients together. There is a uniqueness in bringing diagnostics on the same platform, right? I mean, that is also a big deal. It is a healthcare system. It's not just a platform. And I think that was what I found very, very interesting and unique about NeuroX. So it's very exciting to be a part of this journey.
Thank you, Dr. Syed, for being part of NeuroX and also for your time today. Wonderful. We and Adrian, thank you for your time, and thank you.
Yes, thank you for joining us. It's been a pleasure meeting you.
Thank you. Thank you both. It was great.